in Bronie's well, and I have my favorite friend and Dr. Joel Wallach with us again today. And hi, Doc, it's been a little while. We don't get on every week like we were used to, but that's okay. But I have been seeing these ads on TV here in Australia for a condition called, well, some call it 22q, some call it Q22, and I see the Mayo Clinic calls it the DiGeorge syndrome. And I'm thinking, maybe a lot of people out there like me have no idea what they're talking about, because on the ad, all they're doing is asking for donations. They're not explaining it. They're not giving any indication as to what this is. They're just saying, oh, all these people suffer from it and hundreds of thousands, and it's growing or whatever. So I thought the best person to ask to answer this question would be my dearest friend, who's a researcher and all that sort of stuff, Dr. Joel Wallach. So with no further ado, I'm going to hand it over to you, Doc, if you could share with us or explain to us first what this is, what it stands for,
sure,
and what it involves,
and what we can do about it.
Yes, and what we can do about it.
Okay. Well, thank you so much for bringing this up. It's kind of an interesting story. Okay. It occurs in all vertebrates, whether a cow or a human or or a rabbit, it doesn't matter. All vertebrates can get this syndrome. Okay, DiGeorge syndrome, 22q, 11.2 deletion syndrome. All right. It's caused by a small part of the chromosome 22 is missing. In other words, it's a birth defect. A piece of the 22 chromosome is missing. Now, the interesting thing about it is it's not going to be the same piece every time. Let's say the chromosome is an inch long, and you could have 25 different spots where it's missing. And so it shows up differently. Some people get them all missing. Some people just get 2 at the north, and some get 2 in the middle. Some get 2 in the south. Some get 1 in the north, 1 in the south. And so the nerve picture is highly variable. Okay, it's very easy to tell that it is the DiGeorge syndrome. Okay, so let's look at this. The term 2211.2 deletion syndrome covers terms once thought to be different conditions. Okay, these terms include DiGeorge syndrome, velocardiofacial syndrome, and other conditions caused by the same missing part of chromosome 22. But features may vary. Okay, medical problems commonly related to 22q11.2 deletion syndrome include heart problems, lowered immunity, a cleft palate, complications from low levels of calcium, various eye issues and diseases, autoimmune disorders. Complications also include hearing loss, skeletal differences from right and left side, kidney differences between the left and right side, genital differences from right and left side, and delayed development with behavioral and emotional problems with kids going through puberty. So this is a wide range of stuff going on because it's a chromosome with a long tail. So any little piece missing in there, you get something going on, right?
Yeah, that's why I thought it was so confusing to people.
And it's confusing to doctors.
Clearly.
Yeah, they make the mistake that it's a genetic thing. It is not a genetic thing. It's a nutritional deficiency for months before the woman gets pregnant.
And all those things you just listed there, the doctors call them different things. So you're virtually connecting them all to this chromosome.
I'm a pathologist. I get to see them in the microscope after they're dead.
Yeah, and that's amazing to me. So people could be being misdiagnosed quite easily.
Okay. The number and severity of symptoms relates to 22q 11.2 deletion syndrome. They vary, but specialists in various fields need to treat almost everyone for all these symptoms in the syndrome. Okay, it's kind of interesting. That way they get to send their kids to college. Okay, symptoms of DiGeorge syndrome can vary based on what body systems were affected. In other words, do they have the deficiency for the entire pregnancy? Do they just have it for a few weeks? That sort of thing. Okay. Mm. And the severity of the problems, some symptoms may be clear at birth, but others may not appear until early infancy or as a young child, or maybe even as an adult. Symptoms of the DiGeorge syndrome. Okay, here we go. Heart issues, such as problems with the structure of the heart, blood vessels or heart murmur, bluish skin because of poor circulation of blood, also known as cyanosis, frequent infections, the immune system, distinctive facial features such as an underdeveloped chin, ears that look different, wide-set eyes, hooded eyes, and an enlarged nose tip, okay? Asymmetric crying faces also may be present. In other words, when they're crying, one eye cries, the other eye doesn't cry. This is when muscles on one side of the mouth don't develop fully, causing that side of the mouth to droop when crying, though the face looks balanced at rest. A gap in the roof of the mouth, also known as a cleft palate, or other problems with the palate, a hard time feeding the baby with a bottle, failure to gain weight or stomach issues, hearing loss, poor muscle tone, kidney problems. Now, this is all one chromosome. Poor vision, and other eye problems, low levels of calcium in the blood, scoliosis, delayed growth, delayed development, such as delays in rolling over, sitting up, or other infant milestones, delayed speech development or nasal sounding speech, learning delays or disabilities, behavioral problems, when to see a doctor. Other conditions may cause symptoms like 22q11.2 deletion syndrome. Okay, it's important to get the right diagnosis quickly if your child shows any of these symptoms. Okay. Healthcare professionals may suspect 22q11.2 deletion syndrome at birth if a severe heart problem, cleft palate, or other signs typical of 22q11.2 deletion syndrome are clear at birth. Tests likely will be done before your child even leaves the hospital. Let's see, at well baby visits, illnesses or conditions that are typical of 22q11.2 deletion syndrome may become clear over time. Your child's healthcare professional pardon me, sorry about all that, may see these issues during regularly scheduled well baby visits or annual checkups. Causes. Okay, here we go. That's my interest. What's the cause of all this? Right?
Yes.
Each person has two copies of chromosome 22, one on the right side, one on the left side. Okay? One inherited from each parent. If a person has the DiGeorge syndrome, one copy of chromosome 22 is missing, a segment that includes an estimated 30 to 40 genes. Many of these genes haven't been clearly identified and are not well understood. The region of chromosome 22 that's deleted is known as 22q11.2. The the deletion of genes, okay, from the chromosome 22 usually occurs as a random event in the father's sperm or in the mother's egg, or it may occur early in pregnancy as the baby is developing. Rarely the deletion is passed to a child from a parent who also has deletion in chromosome 22, but they may have fewer or mild symptoms. Okay, risk factors. Babies who are missing a portion of chromosome 22, specifically a region known as 22q11.2, are at the most risk of DiGeorge syndrome. This missing portion causes several body systems to develop poorly and reduce function.
Well, see there, because they say it's not inherited, so they can't say it's an inherited disease, can they?
No, it's not a genetic disease. It's a
Mm.
nutritional deficiency. Okay. It's
Yes,
not
but
caused by bad genes.
your paper there is actually saying that, isn't it? So it's like the doctors can't say, oh, well, your dad had it or your mum had it, so you're gonna have it. At
No,
least
that's yeah,
people that
that's
have
not
it,
true.
then they can be reassured of when they go and have a baby themselves, their baby's not necessarily going to inherit
If they
that.
are very good about getting rid of all the bad foods and take all 90 essential nutrients for, say, 6 months, then they take an egg and a sperm from the mother to be and the baby to be and have a look at it under the microscope, okay, and see if they can tell if there's anything wrong there. And then they've got to make a choice. Are they going to, uh, save an egg and a sperm? And, after they've done all the research and everything, they say, well, we're confident that there's nothing bad there and they can have a pregnancy. They might have a good pregnancy. They might have a DiGeorge pregnancy. So it's okay. So that's one of those things. Okay, heart issues. 22q11.2 deletion syndrome often causes heart problems. It could lead to too little oxygen-rich blood. For example, problems may include a hole between the lower chambers, between the right and left side of the heart. Okay, also known as ventricular septal defects, or there may be only one large vessel rather than two vessels leading out of the heart, also known as truncus arteriosus, or there may be four problems with the heart structure, also known as tetralogy of Fallot. Okay, then there's hypoparathyroidism. The four parathyroid glands in the neck regulate the levels of calcium and phosphorus in the body. 22q11.2 deletion syndrome can cause parathyroid glands to be smaller than usual and produce too little parathyroid hormone. Leads to hypoparathyroidism. This condition results in low levels of calcium and high levels of phosphorus in the blood, leading to all kinds of bone defects. Thymus gland dysfunction. Cleft palate, a common condition, 22q11.2. Deletion syndrome is has a cleft palate, okay, which is an opening between the roof of the mouth and the mouth itself. Other less visible symptoms of the structure of the palate can make it hard to swallow or make even certain sounds in speech. Distinct facial features, a number of particular facial features may be present for some people with 22q11.2 deletion syndrome. These may include small, low-set ears, short width of eye openings, hooded eyes, a relatively long face, an enlarged nose, or a short or flattened groove in the upper lip. Learning, behavioral, and mental health issues may be part of the 22q11.2 deletion syndrome, may cause problems with development and function of the brain, resulting in learning disabilities, social development, or behavioral problems, delays in toddler speech development, and findings as hard to learn are common in this situation. Some children develop attention deficit disorder, hyperactivity condition, ADHD, or autism spectrum disorder later in life. The risk of depression, anxiety, and other mental health conditions are higher than the normal person. Autoimmune conditions, people with 22q11.2 deletion syndrome may also have a greater risk of getting autoimmune conditions such as rheumatoid arthritis. Well, rheumatoid arthritis is not an autoimmune condition. It's actually caused by an infection and Graves' disease, okay? Other problems. Many medical conditions may be related to 22q11.2 deletion syndrome, such as hearing problems, eye problems, and poor kidney function. All these are caused by failure to develop properly because their mama was missing something. She may have been eating gluten with every meal and not taking vitamins and minerals, and that's why the baby turned out this way. Prevention. In some cases, an infected or affected parent may pass DiGeorge syndrome to a child. If you're worried about a family history of 22q11.2 deletion syndrome, or if you already have a child with the syndrome, you may want to see a doctor who specializes in these genetic conditions. This is not a genetic condition, okay? This doctor is
They
called
sort of contradict themselves there, didn't they, Doc? Because earlier they're saying, well, just because your parents have it, just because you have it, doesn't mean your child will have it.
That's correct.
So there's sort of, I thought that very confusing. It's very concerning that they contradict themselves again, you know, and I find the medical world does that quite a lot, contradicting themselves all the time. I guess that's because they actually don't really know.
Well, they actually don't know. And so they're trying to cover their bases by, giving wide statements that could go either way. And that way they feel that they won't be found ignorant. Okay, but it's a sad situation. If they'd be taking the 90 essential nutrients and stay away from the bad food for all their young life, when they get old enough to have their babies, they just keep doing the same thing, all the 90 essential nutrients, okay, plus the nutrients necessary for pregnancies and development of embryos, start taking that for a month or two before they get pregnant, there won't be any more birth defects. If you're depending on eating well and getting all your nutrition from your food, it's not going to be good. Plants only need 3 minerals. We need 60. Then you go back, Ron, when you go back thousands of years ago, until 1822, we were using wood and coal as fuel. We're putting the wood ashes and coal ashes into our garden for fertilizer. We're putting the wood ashes and coal ashes into our food for a supplement. Well, 1822, we switched to electricity.
Yeah.
There were no more wood ashes or coal ashes anymore. And this transition, okay, is in this book, covered in this book, Hell's Kitchen. It'll make you cry. All the terrible things that have happened to us after thousands of years, okay, of not having doctors and this and the other, but, grandma taught them to eat the wood ashes and put them in your food and put them in your garden. Same thing with the coal ashes and everything. But when they went to electricity, they threw it all to the wind. And that's when we started getting problems. There's people today who still don't take vitamins and minerals. And so this is our responsibility as moms and dads and
I know. I'm astounded at the number of people that call themselves health coaches and not certified. They're not certified holistic health coaches like myself. And I actually had one lady reached out to me yesterday and saying, did she want to be a health coach? She said, oh, no, I'm already a health coach, blah, blah, blah. And I said, oh, so you recommend the 90 essential supplements to your clients? She said, oh, no, I don't give them any supplements. I do all this other stuff with them first, and maybe I might. And she just, and I'm thinking, they're essential. How can you not recommend at least the basics?
Yeah,
I know we have add-ons, but if you're not getting the basics, you're losing out. How can you be a health coach if you're not helping them in that way? Or not recommending them, at least. I mean, you can't force people to take anything, but you can certainly recommend.
You're giving them good advice. And it's one of those things where we learned this in the animal industry because we don't have health insurance for babies that are born with birth defects and this, that, and the other. And they would test the foods and everything in laboratory animals, and in laboratory animals get the same birth defect as a calf or a lamb or a pig or a chicken or a turkey or something. And so they started looking it up, and they would make a food for rats and rabbits and that sort of thing, and they leave out one vitamin, and they would get a disease. If they were pregnant, they get a birth defect from that one vitamin deficiency. Okay. Then they use the same exact formula, but put that vitamin in there and give it to another group of the same animals, no problems. And this is how they figured it out. Okay.
And so that in itself says to me, and as soon as I worked out what 22q was and what they were going on about, I'm thinking, hang on, this is a preventable syndrome. This is something
Yes.
we can prevent, and we need to educate people at how essential these 90s are so these sorts of things don't happen. And yes, sadly, the majority of the world don't want to listen, and then they wonder why their children are born with defects. And they said, oh, if only I'd known. Well, I tried to share with you, but you didn't want to hear. You didn't want to know. No, my doctor says I don't need to take supplements. I don't need to do this. In fact, a lot of doctors will tell pregnant women not to have some of their vitamins and minerals and stuff. And I'm thinking,
Well, they just tell them, eat well, you're going to get everything you need. That's absolutely a lie.
it just astounds me. And people just say, well, I'm not going to listen to you. I'm just going to listen to the doctor. And then cry wolf, like get really upset when their baby's born with a defect. So let's educate the world to the fact that you don't need to have your children born with Q22. And if they've already got
Epigenetic.
it, that's exactly
Epigenetic.
right. And if they've
Rare
already got
earth
it,
theories.
the 90
It's all
essential
in your head.
nutrients would help them. They're great books, Doc. I have
The
all of
Wallach
them bar that
Revolution.
one. I haven't got that one yet.
You don't have the Wallach Revolution yet? Oh my gosh.
No, because we have suppliers here in Australia that they bring them in bulk for us, and I don't think. Oh, I must actually ask them. The last time I asked them, it hadn't arrived yet, so I must ask them again soon.
Yeah, check it out.
Yeah, but it's they just bring it in bulk so that it's not costing us as much in the shipping and the exchange
Yeah,
money.
after 1822, we started getting so many birth defects that nobody had ever seen before.
Mm.
And that's because they weren't eating the wood ashes and coal ashes anymore. They went to electricity. Cleaner, 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 but no nutrition.
Yeah, that's right, and it's sad to see that people are just so convinced that they're getting everything they need in their foods, and our foods are being poisoned more and more every day.
Yeah.
That's
Well, the poisons going in is another issue. But when you talk about just the deficiencies, because plants only need 3 minerals, we need 60.
mm.
Okay. And so
I
you
saw
can have those plants can have all the most beautiful of the 3 minerals they need,
yeah,
and they're short by 57.
yeah. I mean, I saw this great cartoon recently, and where this guy's got this the mask on that they put on when they go and spray chemicals, right? A big full face mask, and this little animal is saying to the guy, "So do you eat this fruit with that mask on?" I thought, exactly right. You're poisoning the food, but you go and eat it with it, go and eat something you've just sprayed all this poison all over. So anyway, it was a really good cartoon.
Yeah, it's really a sad note that still goes on. You'd think with the education systems that people would be up to date on information. Or if they weren't, they could say, okay, I need to study this for a little bit before I start growing food for the family. Is there anything special I need to do? Anything I need to put in the soil? Anything I need to do to feed those plants so they're the best they can be for us? But they don't do that. They just get the little bag of seeds and throw them in the ground, and
Hope
they
for the
make a little
best.
bag of fertilizer with 3 nutrients in it, and that's about it.
Exactly right. So back to the Q22. Okay, we know what people that are planning on getting pregnant, both the father and the mother, they both need to have their essential 90, so that to start with. So those who are then born with it, what can we do to help them? Now, I don't know if we can reverse it, but at least help them to
Well, some
cope
of
with
them you
it
can
better.
actually reduce the severity of the problem. Some of them are reversible, but most are not.
So how can we help them to at least be better able to manage some of these conditions? Read, well, we have to do more than
Education.
read the books, but yes, that's the books
Education.
those books are great. And if you want
And
those
so
books, guys, reach
this
out
is
to me
why,
and I'll
Bronwyn, this is why we have to have meetings of our longevity family and educate them. And this is why we have the health coaches, and we had to graduate to the certified health coaches to make sure that they were reading everything we wanted them to read. Okay.
Yes.
And I think we got like 1,200 certified health coaches now. My goal
Yeah.
is to have 10,000 certified health coaches, and they are going to help save humanity because we have the capacity to have every baby being born normal.
Yes, we do.
That's the beauty of it. We can have a promise of every baby being born normal, and we don't have to worry about all these different birth defects, including the DiGeorge syndrome, 22q, 11.2, deletion syndrome. All those things we can prevent. Now, once you've got them, there may be, out of the 50 different things going on in that chromosome number 22, you might be able to improve the function of, out of the 22 chromosomes, you may be able to help 3 or 5 or something like that. But the others, they're permanently damaged.
Yeah, like the cleft palate, you have to have surgery. Well, most have surgery to try and correct that to a point, but it still causes all sorts of other issues just having a cleft palate.
It is correct.
Mm. Well, and yes, and that's that's the importance I wanted to get out about this condition. Firstly, I wanted people to understand what it was because they really aren't putting it out there. They're just they, like I said, they're advertising for people to donate money to their cause, but they're not saying what it involves. What is it? They're just leaving people, well, what is this? What do you want me to donate money
It's a preventable terrible error.
Mm.
Okay.
So
It's a preventable terrible error.
it's sad, and so many other things are preventable, and that breaks my heart that we know
Yeah.
we can do something about it, and yeah.
And you can give them the 90 essential nutrients, and out of the 50 or 60 different symptoms they get, you might be able to reduce the severity of out of the 50, you might be able to reduce the severity of maybe 10. As I said, reduce the severity, not get rid of it.
Yeah. Yeah. So because like for those who have the part that affects their heart, I would personally recommend our healthy body, brain, and heart pack, for example, not just the 90 because it has the 90 in it, but they need that added extra. And then I'll try and think of some of the others that were on there. And then those with autoimmune diseases, I'd still probably recommend the healthy body, brain, and heart pack, plus maybe a couple of extra things.
And of course, when you're working at that, you're going to eliminate Down syndrome. You're going to eliminate babies that are born deaf and babies, with all kinds of other birth defects, because you're consciously, proactively putting all these nutrients in their formula. And when you do that, you're going to prevent all these other birth defects that used to occur. But you got to make sure they're not getting any gluten, because if you give them everything perfectly and they're eating crackers and they're eating cookies and they're eating bread and they're eating cereal and your intestines are dead, all those villi go away and it's just like a smooth plastic tube.
Yeah,
You say, well, I think it said, and they still got all these birth defects. Well, what did you give them for breakfast every morning? Oh, they got cereal, and it was whole wheat. Well, there's your problem. Okay,
yes.
you should send the whole wheat cereals and when we're having pile it up, and when we have wars against an entity, just give them those cereals that have all those grains in them.
Yes, that's a good idea. Anyway, but yeah, so I just wanted to bring, like I said, this condition to people's attention and be more vigilant with what you're having before you get pregnant. And if you suffer with one of these conditions, please at least take the basic 90 to at least reduce your symptoms and help you maybe to live a longer, better life in that respect.
Absolutely.
So,
And
Doc, so
let's
I
talk
don't.
about two. I want to quickly talk about two common things.
Okay.
One of course is diabetes and low blood sugar. We have the sweeties. It gives your pancreas what it needs, your liver what it needs to get rid of those diseases.
Mm-hmm.
Diabetes. This will get rid of diabetes. Type 2
Yeah.
diabetes, which is like 95 to 96% of the diabetes. This will get rid of type 2 diabetes. Type 1 diabetes, you can't get rid of it, but because it was one of these birth defects that you find in this
But I would still give
I22.
someone with type 1 diabetes the sweeties because it would reduce it at least.
Yeah, it'll reduce it, but they have to stay on this forever because they're not
Mm.
making any of this stuff themselves. Okay, and then if they have thyroid issues, they need the Ocean's Gold. Now, the Ocean's Gold, now look how this is. This Ocean's Gold has all these sources of iodine and copper, which your thyroid needs. If you're having thyroid problems, you want the Ocean's Gold. It has chlorella, kelp, spirulina, Irish moss. Let's see here. Atlantic wakame, dulse, porphyria, okay, seed lettuce, and then wakame. Now, where did all these plants and things get their iodine and copper from? From the seaweed in the ocean where they grow.
Yeah. Yeah.
And that's why there's
And
some countries and cultures don't get these problems because they're eating the seaweed.
well, that's true. I would add thyroid, the fucoid C to the thyroid issues as well. So you're getting the other oceans goodness. This from down under. That's what I would do. And talking about thyroids, what if someone has had their thyroid removed? What would you recommend for them to do? Would you still recommend they take the Fucoid Z and the Ocean's Gold, which I don't have sitting right
Oh
here?
yeah,
Oh, yes, I do. Oh, look, I have both sitting right here with me.
there you go. But then they need to take the thyroid hormones. Okay, also, if their thyroid's been removed, they can actually get thyroid hormones. They're already
Okay.
made.
Do we have those?
Mm-hmm.
Which ones are they in? Or maybe we don't have it down under. I don't know.
No, it's not an art product. It's a prescription drug.
Oh, okay. But they would still have these two. Would you recommend both these as well? Yeah, because it's interesting because I'm astounded at the number of people who've had their thyroid removed, and it's the thing that regulates our body. It's
Yeah.
our
And
thermometer.
instead of these, well, they got a big goiter. Let's just remove it.
Mm.
I just feel so wonderful. And then 2 months later, you're sick, and a year later, they die. Okay. They need to be taking all 90 essential nutrients. They need plus, okay, the ocean's gold. They get them off all the bad foods so they can absorb this stuff. And the goiter will go away in weeks.
Mm.
You can have a goiter for 25 years. You take all the right stuff and get rid of all the bad stuff, and the goiter will go away in anywhere from 2 to 4 weeks. And how long do you have to stay on that program? Forever.
Yeah. Well, it's essential for life, isn't it?
Mm-hmm.
It's so our body can thrive, not just survive. That's what the essentials are for. Correct?
It's correct.
That's why I say to
Okay.
people, why do I need those? I'm okay. Yeah, you're just okay. You're not thriving. You're not enjoying life to its fullest, without, you know, I know, and it's not very often I don't have them every day. I usually do have them every day, but sometimes shipment gets here a little bit late or, you know, but, and I think, what the heck? Why am I a bit slow today? And then I realize, whoops, I missed them because I might have missed breakfast, for whatever reason. Or so, yes, it's not necessarily the first day, but it's certainly the second day.
Yeah. It's kind of like if you would put dirt from Texas in your car because there's bound to be some oil and gasoline in it rather than oil and gasoline.
Your car wouldn't go very far. And sometimes I do little experiments on myself so that I can see the effect. And I know we shouldn't, but when people say, oh, look, how would you know that's working? Well, so you don't have it for a day or two, thinking, yeah, I know what's wrong. And as soon as I have it again, I'm good. So, but yeah, we have that. We sometimes we've got to be our own experiment to prove to others that it works, it helps. And I like to thrive, Doc, instead of just survive.
Yeah, you want to thrive. You don't want to just survive because you want to be there for yourself. You want to be there for your spouse. You want to be there for your family. You want to be there for your neighbors. You want to be there for your church mates. You want to be there for your community. And so it takes a lot of preparation and defense to cover all that territory.
Yeah, it does. And we do the world no good if we're just surviving. But
It's not good.
no, it's not. Well, Doc, I think we've sort of covered everything on that today, unless you can
Okay.
think of something else.
Do you have another question or you want to call it a day?
No, no, I want to leave it there. I want it because I really want to get the importance of the night essential out to people and how they can help people that do already suffer with 22q or Q22 or DiGeorge syndrome, whatever you want to call it in your part of the world. And so that's what I want to do today. So, Doc, I thank you very much for coming to Bronie's World at Bronie's desk today. And as I asked everyone nicely to stay safe, stay informed, be empowered, but do not live in fear, my friends. And when you are taking your 90 essential nutrients, then you too will be powerful, beautiful, brilliant, and most definitely very brave. And you'll certainly thrive. So thank you. Goodbye. And God bless you all.
God